or indirect evidence like showing the causative organisms, antigens or antibodies in patients, blood, that is serum or plasma, by different serological tests. General rules include first the specimen collection for the diagnosis of a specific causative agent like sputum, pus, CSF, exudates, feces, blood, skin scrapings, throat swabs, etc. You have to think of appropriate specimen for the concerned organism to be diagnosed. For example, in case of Staphylococci, it is a pyogenic cocci. So the first thing is pus. If cough is there due to Staphylococci, sputum. If meningitis is there due to Staphylococci, it is CSF. Suppose bacteremia or toxemia or pyemia due to Staphylococci is there, you have to collect blood for blood culture. Feces or food remnants in case of food poisoning. Nasal swabs in case of carriers of methicillin-resistant Staphylococcus aureus, that is called MRSA. Some countries never allow people to enter into their countries if they are methicillin-resistant Staphylococcus carriers. People are going for employment to various countries in the world. Some countries, they may not allow because you have to take a report that your nose is free of methicillin-resistant Staphylococcus aureus. Now, as I spoke earlier, direct evidence, indirect evidence. So the direct evidence is direct smear examination. You take the specimen, do gram stain, you will see gram-positive cocci in clusters. If you do a culture with the specimen on mutant agar, bread agar and macaque agars, or take a selective medium like gelatin mannitol salt agar and try to isolate the Staphylococcus aureus, which is the only pathogen causing various infections in the human being. If you see the direct evidence by seeing the endopigments produced by the Staphylococcus. There are three pigments produced by Staphylococci. One is golden yellow pigment, what you can see here, that is due to Staphylococcus aureus. AU indicates gold because it is producing golden yellow pigment. That's why it is called aureus. And these two are non-pathogens. Of course, sometimes they will also cause pathogenicity in certain individuals. That is Staph epidermidis, which produce a white pigment. Previously, it is called as Staph albus. Albus means white. Staph citrus, which produce lemon yellow pigment. Now, the Staphylococci are broadly divided into pathogenic and non-pathogenic. Pathogenic Staphylococcus is Staphylococcus aureus. This is the only genus having a species of aureus in Staphylococci. It has certain properties. It produces enzyme coagulase. These enzymes are two types, free and bound, which we are going to see later. And greater biochemical activity and ferment mannitol sugar produce beta hemolysis on blood agar, produce golden yellow pigment on blood agar or on mutant agar, liquefy gelatin, produce phosphatases and protease enzymes, reduce potassium telluride into metallic tellurium, producing black polonies, produce thermostable nucleases, and produce lipases and proteases. So, among these 9 properties by Staphylococcus aureus, if you show any two among these 9, you can say that Staphylococci is pathogenic. Generally, we try to diagnose Staphylococcus aureus using the enzyme coagulase, that is free and bound, and we will try to see the beta hemolysis on blood agar. So if you show the direct evidence from sputum of a patient with cough, we can see the gram-positive cocci, violet-colored cocci in clusters against the gram-negative colored pus cells and epithelial cells. Pus cells and epithelial cells. This is pus. These are all dead neutrophils or pus cells. These are gram-positive cocci in clusters. When you culture the organism either on the nutrient agar or blood agar or mechanc agar, take a small part of it, do gram stain, you will find plenty of gram-positive cocci in small or big clusters. Now this is the growth on nutrient agar with slight golden yellow pigment. Because you want to see a nice pigment, you have to grow on milk agar. You have to grow on milk agar. Here you can see on the blood agar, you can see clear golden yellow pigment produced by Staphylococcus aureus. Here is the catalase test. Because all Staphylococci, whether it is pathogenic or non-pathogenic, they are catalase positive. Here, what you will do, you will take 3 or 4 drops of 10% hydrogen peroxide, add 1 or 2 colonies of pure growth of Staphylococci, which contains this catalase enzyme. Immediately, you will get bubbles in the mixer, that is due to the splitting of hydrogen peroxide by staphylococcal catalase, water into nascent oxygen. That nascent oxygen will form as air bubbles. Whereas a negative control, you will not see any air bubbles. So Staphylococci are catalase positive, Streptococci are catalase negative. You can see it's very clear. Catalase test producing air bubbles. This is positive. Here it is negative. So on suspected colonies of Staphylococci, you have to do a coagulase test. So there are 2 types of coagulase tests. One is for the bound coagulase, that is by slide test, and free coagulase by tube test. We will see what is this bound coagulase test and what is this free coagulase test. Now here you have to remember a Staphylococcus aureus may carry or may contain both coagulase enzymes, that is a free coagulase enzyme and bound coagulase enzyme, or they may contain either of one. Some may contain only bound coagulase, some may contain only free coagulase, some may contain both. So to differentiate the pathogenic strains from non-pathogenic strains, you will do a slide coagulase test first. It is a screening test which you can see, or you can do 5 or 6 staphylococcal isolates on a single slide, which detects bound coagulase. Now take staphylococci emulsified in a drop of normal saline on a clean glass slide, mix with a drop of undiluted rabbit or human plasma. Prompt clumping of organisms shows a slide coagulase test positive. No clumps, that is coagulous, negative. You can see, you will take the emulsified Staphylococcus aureus in 1 or 2 drops of normal saline on both sides. Make T on the test side. Other side you write control. So on the test side, you put 1 or 2 drops of undiluted human or rabbit plasma. Here you must differentiate what is plasma, what is serum. So already discussed, there is no need of any further discussion to differentiate plasma and serum. Here we have to add plasma, not serum. So just by tilting, you will see formation of clumps like this, showing that Staphylococcal aureus strain contains bound coagulase. On the control side, there is no change. On the control side, there is no change, where you are not adding any plasma. If this also shows the clumping, that means the test is not correct. You have to repeat the test with fresh prepared normal saline. Now, suppose you have done on the day around 10 Staphylococcus aureus bound coagulase tests on the slide. 6 have come negative, 4 has come positive. So positive is positive. You can stamp them as pathogenic staphylococci, that is Staphylococcus aureus. What about this remaining 6 strains which have not given a positive test? You should not say that is not Staphylococcus aureus, because that may not contain bound coagulase enzyme. It might have contained the free coagulase enzyme, which can be done in a tube. Now, what is this tube coagulase test? How it will be performed? This tube coagulase test detects extracellular free coagulase, which is formed in the medium and let out by the Staphylococcus aureus cells into the medium. Take 1 ml of broth culture of 4 to 6 hours duration, is mixed with 0.5 ml of 1 in 5 dilution of human or rabbit plasma. Here, you should not take pure plasma or undiluted plasma. You have to dilute it 1 in 5 times in normal saline. Such diluted plasma, you have to take 0.5 ml and you have to add to 1.1 ml of broth. Now, take a negative control, that is only diluted plasma without addition of this broth. Now, I told so many times what is broth. So, a bacterial growth in a liquid medium is called broth. Now, the tubes are incubated in water bath or incubated at 7 degrees centigrade for 3 to 6 hours. And you have to test every half an hour up to maximum 4 hours. Anytime, maybe after half an hour or 1 hour or 1.5 hours or 2 hours, 2.5 hours or 3 hours or 3.5 hours or 4 hours. Suddenly, it gives a positive test. How to read that positive test? I will show the diagrams. You will understand which is positive and which is negative tube coagulase test. So you will tilt the tube at 30 degrees angle. If that is not falling, it is tube coagulase test positive. If it is falling, it is tube coagulase test negative. Here it is not falling, it is positive. it is falling, it is negative. So among these 6 slight coagulase negative strains, if anything is giving positive for this tube coagulase test, you can say that strain is positive and that strain is Staphylococcus aureus. So that test also negative, then you can stamp it is non-pathogenic staphylococci, it is not Staphylococcus aureus, even though it is showing on the gram stain gram positive cocci as clusters. Now coming to deciding this strain is Staphylococcus aureus, now it is your responsibility to give an antibiotic sensitivity pattern for the patient, because simply you should not leave the patient saying that your specimen got Staphylococcus aureus. Now, before going to this antibiotic sensitivity testing, we must know what are the different antibiotics that will kill Staphylococcus aureus. Suppose a non-penicillinase producing Staphylococcus aureus, you have to treat that condition with benzyl or crystalline penicillin. Now, 100% of Staphylococcus aureus nowadays in the world, they are penicillinase producers or beta-lactamase producers. So, you cannot think of treating a patient with benzyl or crystalline penicillin. Now, the second thing is, if they are producing penicillinase or beta-lactamase, you can use penicillinase resistant penicillins like methicillin, cloxacillin or oxacillin. That is for methicillin resistant Staphylococcus aureus. Suppose the Staphylococci is also resistant to methicillin, cloxacillin or oxacillin, which we call them as MRSA or methicillin resistant Staphylococcus aureus. You have to use vancomycin. Nowadays, the vancomycin also becoming resistant by 2 ways, by producing vancomycin intermediate resistant Staphylococci or vancomycin resistant Staphylococci. You have to use daptomycin. This is the latest drug for the treatment of Staphylococci, daptomycin. Generally, the antibiotic sensitivity testing is done by Kirby-Boyer diffusion technique. In case of vancomycin resistant, you have used agar dilution method to identify VISA or VRSA, that is vancomycin intermediate Staphylococcus aureus, vancomycin resistant Staphylococcus aureus. Now, this is the antibiotic sensitivity pattern, which you already learned how to do a antibiotic sensitivity test. Here, the Staphylococci was grown as a lawn culture on Muller-Hinton agar, and over that you kept the antibiotic discs with certain amount of antibiotic. If there is an inhibition which is measured in mm, and with the standards, you can say that is positive or negative or resistant or sensitive to that drug. So here it is clearly sensitive for this drug. Here it is moderately sensitive. You should not use this drug or this drug or this drug or this drug. These 3 are resistant. So you have to suggest this drug to the patient to kill that Staphylococcus aureus. No other way to see the vancomycin resistance by using a comb test. It is just like a comb where each part of it contains different amounts of vancomycin. Basing on the sensitivity pattern, you can decide whether it is VISA or PRSA. Now, other than Staphylococcus aureus, Certain times, the non-pathogenic staphylococci also produce certain infections. So such staphylococci are Staph epidermidis, which produce white pigment, is sensitive to novobiosine, whereas Staphylococcus saprophyticus, another non-pathogenic staphylococci, which may sometimes cause urinary tract infection in females, it is novobiosine resistant. So you can differentiate by using novobiosine sensitivity or resistance, whether it is saprophyticus or epidermidis. Micrococci. Sometimes, basing on your gram stain, you mistake micrococci as staphylococci unless you have experience in reading the gram stain. So these are also gram positive cocci, bigger than staphylococci, but not arranged in clusters. They are arranged in pairs, tetrads, or irregular clusters. Occur as saprophytes and common cells. Cells are larger than staphylococci, more gram variable than staphylococci, form small colonies, white in color, rarely cause opportunistic infections, and they show oxidative property, where staphylococci, they are oxidase negative. You can see they are seen as groups of four. Groups of four. And this is staphylococci. You cannot see anywhere in a groups of four. Now, how to differentiate Staphylococcus aureus from Micrococcus? Gram staining, if you take Staphylococci, they are gram positive. Micrococci also gram positive, but they are darkly stained. Staphylococcus aureus, they are grape-like clusters, whereas Micrococci, they are present in groups of four tetrads or sometimes 8. You have uniform staining of all the cells, whereas the staining of micrococci is not uniform. It is 1 micrometer in size, the diameter is 1 micrometer, whereas micrococci is almost 2 micrometers in size, the diameter, it is larger than staphylococci. Colonies are golden yellow in color, colonies are generally white in color. If you do coagulase test, which I have discussed earlier, coagulase positive, but micrococci, they are negative. Breakdown of carbohydrates, OF test, fermentation only, here it is oxidative, because micrococci will come as a short note in the university exam. So with this, the laboratory diagnosis of staphylococci is over. Now we are going to see the other end, because these are gram positive cocci. Now we are going to gram negative bacilli. The most common, where you will hear the Escherichia coli and Klebsiella. That is laboratory diagnosis of Escherichia coli and Klebsiella species. Both are in the family Enterobacteriaceae and both are gram negative bacilli. Still, you have to differentiate which is Escherichia coli and which is Klebsiella species. The gram negative bacilli, you can see the pink colored rods. The main medium used to differentiate these two bacilli, it is Mekong agar. It is not bread agar, it is not red, it is orange in color, Mekong agar. So on the Mekong agar, basing on the lactose fermentation, you can broadly divide the bacteria into lactose fermenters, non-lactose fermenters, LF and NLF. So this Escherichia coli and Klebsiella species both are lactose fermenters which produce pink colonies. If there is no pink color, they are non-lactose fermenters. Whereas when you see a pink color, it is lactose fermenter. If you see these lactose fermenting colonies on Mekong agar, here the colonies are small, non-mucoid, whereas the colonies are very big and they are all mucoid, which is Klebsiella. The previous one is Escherichia coli. That is basing on the colonial characters on Mekong agar. But you cannot stamp them seeing the mucoid or non-mucoid on the Mekong agar, because sometimes the Escherichia coli may produce mucoid colonies and Klebsiella may produce non-mucoid colonies. You have to go further tests to differentiate which is Escherichia coli, which is Klebsiella. That is Imvic reactions. Imvic reactions are very important short notes in the university exam, as well as commonly asked in the orals and practicals. I indicate indole, M indicates methyl red, VI, because to make it Imvic, I is a mnemonic, so V is Ojas Prosker, C is citrate utilization. So if you take all these 4 tests at a time, Escherichia coli will produce indole, so indole positive. Escherichia coli is methyl red positive. Ojas Prosker or VP test negative, and citrate utilization negative. Whereas Klebsiella species is indole negative, methyl red negative, Ojas Prosker positive, citrate utilization positive. So simply you can say Escherichia coli plus plus minus minus, Klebsiella minus minus plus plus. So simply without doing all these 4, you can do only indole. If indole is positive, it is Escherichia coli, and indole is negative, it is Klebsiella species. Indole test is commonly kept as a part of the practicals, and it is very easy to identify. We will see what is this indole test. A liquid medium, generally peptone water is taken. The Escherichia coli or Klebsiella is grown 6 hours. You will get the broth. Then you have to use Kovacs reagent. Slowly you will put Kovacs reagent drop by drop from the sides of the test tube, just to form small ring at the top like this. Then slightly aerate or move the tube. Within few seconds, you will get a red ring. Then it is indole positive. There is no change in the color. It is indole negative. So if you get a red ring, it is Escherichia coli. When there is no red ring, it is Klebsiella. Now, the same growth, if you add methyl red, if it is red in color, it is methyl red positive, that is Escherichia coli, and it is yellow, that is negative methyl red, it is Klebsiella. The Ojas Prosker test, if you get a turbidity, it is positive Ojas Prosker. No turbidity, it is Ojas Prosker negative. Because here it is Escherichia coli positive. This is Klebsiella positive. Now you grow the Escherichia coli or Klebsiella on the surface of the citrate agar slope. When it becomes green to blue, it is citrate positive. Generally, Klebsiella is citrate positive. When there is no change, keep in the same green color, it is Klebsiella negative. Now, all 4 tests at a time to show the reactions of Escherichia coli. So, indole positive, methyl red positive, Voges-Prosker negative, citrate negative. That means plus plus, minus minus. Such group of tests is kept in the clinical diagnosis during practicals. If they kept like this, you have to diagnose as the organism tested is Escherichia coli. If these two are kept as negative, these two are kept as positive, then you have to tell the organism is Klebsiella. Now, sugar fermentation reactions. Sugars are fermented, splitting the sugar, producing either alkali or a acid with or without production of gas. To see the gas production, you will keep a Derham's tube inverted, and if you get a bubble of gas in the Derham's tubes with change to pink color, that means that sugar is fermented with or without gas. You can see here these are positive for fermentation, they are 3 negative for fermentation, but there is a gas production in these 2. This is inverted small test tube that is called Derham's tube, where you can see the production of gas. Now, TSI, triple sugar iron agar. Here there are 3 sugars kept in a medium, and you will see different types of reactions. When the medium is completely utilizing all 3 sugars, that medium will become yellow. If there is a gas, you will see breaking of the medium with the production of gas. When it is producing hydrogen sulfide by the organism, you will see blackening of the bottom. This part we call it as butt, and this part we will call it as a slant or slope. So red slant, red butt, no gas, no H2S. This is one type of reaction. We will see what organisms will produce like this. This is an orange color, it's a control without adding any organism. The next one is red slant or pink slant, yellow butt, no gas, no H2S. Here, yellow slant, yellow slant, slightly it is pink, still it will go off sometime. It will become complete yellow slant, yellow butt with production of gas. And this is the reaction of Escherichia coli or Klebsiella. Now, yellow slant, yellow butt, but there is production of H2S. This butt has become black and there is mild production of gas. Here, pink or red slant, yellow but it has H2S production became black with positive gas and positive H2S. So we'll see what are the reactions here. Escherichia coli, Klebsiella and Enterobacter, they produce acid slant, that is yellow, acid butt, that is yellow, gas positive, you can see the breaking of the medium, and there is no blackening of the butt or slant, it is H2S negative. Shigella and Serratia, alkaline slant, that is pink color, acid butt, that is yellow color butt, gas negative and H2S negative, and Salmonella proteus, alkaline slant, acid butt, gas positive, H2S positive. So you will see gas as well as blackening of the butt, that is Salmonella and proteus. Coming to Pseudomonas, it is alkaline slant, alkaline butt, both are pink. No gas, no H2S. So this sheet is kept when you have a TSI medium with some reactions. Basing on these changes in the slant, but production of gas and production of H2S, you have to diagnose the organism in the clinical microbiology practical part. So today we learned the laboratory diagnosis of Staphylococci, Escherichia coli, and Klebsiella, which forms very important topics in the clinical microbiology practical part in your university examination. You have any doubts regarding this practical part of lecture? Then no doubts, we will end this lecture.